We're going to take a little bit of time for some Q&A, and I'm going to, first off, there was a question that came to us out of the ether, where your slides want. No, the question that came to us online was, what can healthcare systems do to improve community awareness of the lung cancer screening programs? Julie, we'll start with you on that one.
Hello. So education is what we can do. One of the things that we are looking at SSM is how can we get into the communities, every community, to offer this education. We're trying to get into churches, women's groups. There's a great organization that does there's a great organization that does prostate screenings, and the demographics, so age, is the same for screenings. So can we tag on with them to help promote lung cancer screenings? So if you know anyone, want somebody to come out and talk, I'm your woman. It's a great thing to do to be able to help and.
Sarah, do you have a comment you want to make on that one also, Sarah?
Yeah. I know we work closely with folks at SLU. Like we are, when it comes to the cancer screenings, the St. Louis community is really united in that respect. Like all of the navigators from BJC and SSM, we're all together on these calls and trying to figure out who's going to go where. We do a lot with trying to go out into the community. Right now, the rest of my team, my other partners, they're down at Pride. We go to churches. We just finished an event at Hazelwood educating young kids about, and high school kiddos about the risks of cancer and smoking. So, we try to be creative because cancer prevention happens before you walk in the door at Siteman. So we got to get you where you are, and that's out in the community. But yeah, churches have been great partners, the school districts. We have a good partnership with the VA health system too.
We was telling you to put that a little closer to your mouth, that's all.
But yeah, we're trying to also start some work with some of the local universities, like, the community colleges and that sort of thing. We go to farmers markets. We were at Point Fest talking about prostate cancer, a big concert. We're really creative with it. We try to be out and present in the community. So if you know of an organization, we can bring our Health on the Move van there and get all of this information right out into the community.
If anyone here has a question, please raise your hand and I'll come around to you. But while we're waiting, Dr. Punch and Dr. Flano, Dr. Punch, you mentioned something very interesting. Actually, it kind of reminded me of my cousin Vinny, where he talks about the dirty windows in his woman's house. That is second and third hand smoke you're talking about. How do we put that together with our risk for developing lung cancer? Explain also what secondary and tertiary risk factors for smoke is, and then put that together with the increased risk associated with radon, if you would.
So we know.
It's on.
Okay. So secondhand smoke, someone smoking, they blow out and whatever is left over from a burning cigarette and you inhale that, that's the secondhand smoke. Tertiary or third-hand smoking is what builds up on the windows and the carpets and the furniture, and that all of these other toxic chemicals and whatever else settle in, and you get that exposure. We see it a lot, especially with kids as they're crawling through the carpet, and then they grow up with, other lung diseases, asthma, sinus problems, stuff like that. But we do know that it does increase the risk or the likelihood of developing lung cancer if you live in a household of somebody that's smoking, as well as with all of the other chronic lung diseases that's there. The hard part is knowing exactly how much to quantitate it so we could start screening. Maybe later in the future we'll do that, but right now we do know that there's an increased risk of having lung diseases, lung cancer being one of them. And then
So Dr. Punch, put that together with, you mentioned about asbestos, but there's another thing from environmental pollutants, particulate matter. You talked about asbestos, but PM 2.5, these really fine sized things. Should we not also be taking this into account when we talk about environmental risk factors with lung cancer?
Yeah, anytime you are exposing your lung cavities, the little sacs of air, to things that create inflammation. You're creating an environment in which your cells are fighting all the time. Cells that are fighting all the time are at risk for having that one cell get the recipe wrong. So it is definitely an additive effect where the air we breathe and the inflammation is a risk factor, quite honestly, for a number of chronic diseases. And it is amazing with newer construction, your grandma's drafty windows actually in some ways are helpful because you're getting fresh air. But tight apartments that are got perfect windows or don't even have really windows that open up and everything is super, super insulated makes the quality of the air definitely can be less. So definitely we learned this in COVID. Building health is ventilation health, and that ventilation, air moving, should ideally also come with some level of filtration. There are ways you can find more about the quality of the air in any closed system, but I think the bottom line is that inflammation is definitely a hand-in-hand part of the risk for cancer. And the truth is there's many different ways that can show up. And there are ways that you can better assess. But the practice of, thinking about ventilation in any closed space, whether it's opening a window or whatever, I think is actually more important than we can imagine.
Thank you very much. We have a question.
There are young smokers as 12, 13, 14, marijuana, cigarettes, vaping. What about that age group for getting lung cancer and getting testing? Do
And-
they have to wait till they get it and they're older?
And also, Dr. Flano, would you comment about just the risk of lung cancer and marijuana smoking?
Yes. So the challenge with younger generation smoking and the risk factors are still there. The problem is we haven't really figured out where a lot of the screening will impact or how it's going to impact the biggest population. So when we screen, there's some limitation. CT scans are expensive and whatever else and stuff like that. And so they try to balance it on where you're going to get more bang for your buck so the price of healthcare doesn't go up in the U.S. Okay. That's why the age limits are a little bit set in that way, and then they adjust a lot of the other criteria so that we get the most out of the money. Who's more likely? The young ones, not as likely. However, the past few years, we've seen some changes, some shifts that we think these screening criteria are going to change. I don't think the one size screening fits all. I've had 29-year-old stage 4 cancer, 34-year-old recently. So these are things that we're looking at, we're following. Starting young, though, and the companies know this, they push that. You heard all the problems with the flavored vape pens and stuff like that, targeting younger kids because nicotine is extremely addictive. Right? More addictive, almost as addictive as cocaine and heroin. So it's that addictive. But you have a growing mind that's growing and it's incorporating these addictive substances into their brain's growth, and it's harder to quit. But when the kids run out of money for those vape pens and whatever else, they're going to go to cigarettes, and that's what they're counting on.
Would you tell us when we talk about the risk of marijuana smoking, and just give us that number that is considered and that puts us into the lifetime risk. What is that number?
Yeah. So we know that if people are heavy marijuana users, they have a twofold likelihood of developing lung cancer within their lifetime. And that heavy criteria means that you've used it at least 50 times in a lifetime. I didn't say a week, because we know some people, right? In a lifetime.
Thank you very much. Yes, sir.
I got a question. I'm born in the 60s now. Saying if you got all this stuff about cancer, now you got majority of the stuff, people who was born in the 60s or the 50s had like lead paint and other stuff on these like miracle spinning wheels and stuff like that these companies put out. What do you think about if a person was born that particular time, would he get a lung cancer or would she get a lung cancer?
Yeah. So I think a lot of those exposures do increase your likelihood of developing lung cancer. I I think when you speak with your primary care physicians, you need to, let them know what you've been exposed to. For example, those that have been in the military and worked around the burn pits, we've seen that. My dad was in the military, 20 years, he got exposed to Agent Orange. He quit smoking 38 years before he was diagnosed with lung cancer. So it's things like that that we'll start to find out more as we start looking more through us looking at clinical trials, using AI to abstract the data and composite to figure out these risk factors. But when you speak with your primary care doctor, we need to let them know what you've been exposed to, because then we can determine risk factors. And just a quick example I throw out there. The Wizard of Oz, you got, all the other stuff like the snow was asbestos flakes that everybody was on the site. Yeah.
Go ahead, Sarah. You
No,
want to come?
It's also important to know some of the occupation, like back in the 50s and 60s, or even up through the 70s and 80s, mechanics were regularly exposed to it because the brake pads contained asbestos. If you worked in HVAC, my grandfather was a veteran. That's probably where he got exposed. Was the HVAC systems on a lot of the ships were just coated in asbestos for fire control. So it's important to know kind of what your possible exposures were. And a doctor's not always going to ask you, well, were you a mechanic? But that's relevant to your health. It's where you live and work. Like, that matters.
We're going to take a final comment from each one of our speakers. I'm going to tell you what I want you to say in 1 minute time. So, Doctor, going to start off with Dr. Punch. What is the best way I can decrease my risk for environmental toxins that can cause cancer?
The best way in St. Louis and North City in particular is to be aware of construction and demolition that's going on in your neighborhood. Consider getting access to at least a one-time spot screening of radon where you live, and recognize the impact that burning tobacco has in your life, even if it's not you doing it.
Okay, thank you. Dr. Flano, we heard a wonderful presentation about the role of AI and how it's going to help us as far as finding and following patients with lung cancer. Is it myth or reality?
I think it's a reality. We've been working with an AI system for the past 4 years to help us actually look at the lung tissue that we do in real time as we're taking a biopsy sample and tell us if we're in the right place or not. That's really helpful because we don't oversample and increase our risk of a procedure, and it helps us know that we have enough tissue to get the proper test we need.
Thank you very much. Julia, does the navigator call me or do I call them? And what is the best way to tell I'm being screwed?
It can be either way. Generally, if there's a navigator there, they're going to reach out to you. But let's say nobody's reached out. Ask when you're diagnosed, is there a navigator? Will she reach out? What can I do? I can also tell you that there are navigators associated, I think it's the American Cancer Society. So somebody can help you if your facility does not have one. Reach out, advocate. Call me, call the,
I will figure it out.
tell me the group again.
Oh, the Lung Cancer Coalition.
All right.
Yes,
Sarah,
that's
since
going to be
you,
a great resource.
all right, Sarah. So my question is, I live in a house with people who smoke. We've heard all these grandmothers smoke. These people blaming grandmothers. I mean, come on. I mean, grandmas are good. What the guy said, grandma's hand, and all this. These people, talking bad about grandmas. But anyway, my grandmother smokes, my uncle smokes, my father smokes in the house. Everybody's in there smoking. I live near a coal mine, and so I'm getting all this radon that's coming up on me, and I'm 36 years old. I'm scared. Can I go and get screened for lung cancer?
Unfortunately, no. And this is where these systems need to change. So currently, the recommendations are very strict about who is eligible for screening. Even folks who, we have a lot of non-smokers who advocate with us on the radon team, who are lifelong non-smokers who have had radon exposure and developed lung cancer, and they were never eligible for lung cancer screenings. And that needs to change. So there are some rumblings that there may be some changes here soon, but I think the biggest thing is just being aware of it. And if you have any signs or symptoms or any reason to suspect that something is off, don't hesitate to reach out to your your healthcare team. Like, trust your gut. If something feels off, you deserve to have it followed up on.
Let's give a hand to our panel. Thank you all very much. And y'all can step down now. You can step down. I want to bring up again Mr. Manhan Shaw to give us a word or two about something you may or may not heard about, something called 340B pricing.